Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk all about cannabis, most popularly referred to as marijuana. And in this video, we're going to learn all about the features of different subtypes of marijuana, the effects it has on the brain and body. I'll talk about something called a cannabis use disorder, and I'll bust some myths at the end. So if you're interested in learning some things that you didn't know about cannabis, stay tuned to the very end and I'm going to bust a few myths. So without further ado, let's talk about cannabis. So cannabis is a drug that is found in a variety of various forms of hemp plants, and that's what we call cannabis. Now, the drugs themselves can come in the form of hashish, which is the solidified resin of the cannabis plant, or the actual buds and leaves or flowering tops, right? So that is the marijuana. Either way, we have the active ingredient for intoxication and getting high as THC. And the greater the THC content, the more powerful the drug is going to be. Now, I say that because there are very many strains of cannabis. And if you are in a state that has legalized cannabis use, for example, Colorado, they will tell you exactly how much THC content there is, the strain of the cannabis, and they'll also talk about CBD, which is then the active ingredient that helps people relax, is good for anxiety conditions and whatnot. However, it doesn't get you high. So that's THC and CBD. When smoked, cannabis produces mixed properties. Some people will get depressant properties, so they'll become more relaxed and mellow. Other people will have stimulant effects such as talking. And then other people might develop similar features as hallucinogenic effects such as paranoia and whatnot. So it is possible at very high doses for a person to have hallucinations and have odd visual experiences and changes in their body image. But at low doses, most people report feeling joy and relaxation. So if you're understanding, then low doses is what's going to get you mellow. Higher doses is going to be more likely to induce psychotic properties. Now, the high itself, in terms of the physical high or intoxication, lasts for about 2 to 6 hours, but the mood changes can persist for a couple days, actually. So let's talk about the disorder, though. Cannabis use disorder. I know that some people think that this is controversial to have a disorder related to this, but we'll get to that shortly. Cannabis use disorder includes 12 months with a minimum of 2 features, where a person is taking more and more of cannabis, or is taking it longer than intended, or has struggled to cut down in their cannabis use. It has invested a significant amount of time either securing the drug, getting high, or recovering from the drug. There are significant cravings. It could interfere with your major work obligations or school obligations or family obligations. It can cause interpersonal problems. And you could retreat from other activities you used to do. You might engage in driving under the influence, which is physically hazardous. And you continue to do all this even though you know that it has caused either a physical or psychological problem. Now, I listed a whole bunch. You don't need all of them. You just need a minimum of 2. But here we go. We also have to have some form of tolerance. Tolerance is marked by either needing more of the drug to get a previously acquired high, or if you don't up the drug, a reduction or diminished effect in the same amount of cannabis. Withdrawal can occur in the form of actual withdrawal, the effects of coming off of cannabis, or smoking to avoid coming off of cannabis, right? So these are your criterion. Now, I will tell you that, actually, before I move on, I will tell you that we do specify severity. Mild severity is 2 to 3 of the symptoms in criterion A. Moderate is 4 to 5, and then severe is 6 plus. We also talk about if you're no longer smoking, if it's in remission, that's early remission is 3 months to 12 months. Sustained remission is greater than 1 year. So that's other specifiers. We also would specify if the reason why you're not using cannabis is because you don't have access to it, such as being in a controlled environment. So that's cannabis use disorder. Now let's start like chipping away at some of the myths. It was previously thought that marijuana could not or does not cause any form of abuse or dependence. However, we know through the National Institute for Drug Abuse that the cannabis that people are smoking today is far more potent than previous strains of the drug. And because it's far more potent, not only do you have the psychological addiction, but you can actually have physical addiction connected to cannabis. All right, we talked about mild, moderate, severe, in remission, and in controlled environment. So what is the relative prevalence of cannabis use? Well, we know that roughly 1.7% of people in the United States in the past year have demonstrated features of marijuana abuse or dependence. And in one's lifespan, it's roughly 1 out of every 20 to 1 out of every 25. So people become addicted. And then what happens if people try and come off of it? I said there are these physical withdrawal effects. A person can report flu-like symptoms, restlessness, and irritability. Each of these features are unpleasant, so it might keep a person continuing to use. Now, if we were to ask the question, is marijuana dangerous? Well, let's take a look at the relative strength. We mentioned that as the strength and the use of the drug has increased, so have the risks. So it can induce panic features, it can induce hallucinogenic features. It can slow down your reaction time or have some sensory motor effects, which could cause car accidents. It interferes with memory. And that's just short term. In the long term, it adds additional issues such as respiratory problems and lung cancer. One of the reasons is that cannabis causes lung cancer is that the vast majority is smoked, and that causes carcinogens, which induces cannabis. In terms of fertility, we also know long-term cannabis use can impact fertility in both males and females. So, but in terms of the attitudes towards cannabis, we say that cannabis in society has had a rocky relationship. So for a long time, for centuries, cannabis was viewed as a medicinal drug. And then when Henry Anslinger came into power, he became known as a drug czar. And he started to criminalize a lot of drugs. And the DEA classified cannabis as a Schedule I drug. And I'm going to speak blatantly, that's wrong, because a Schedule 1 drug implies that it has a significantly high abuse potential and addiction potential and no medicinal value. So if for centuries it has had medicinal value, and currently we do use medicinal marijuana in treatment, then it clearly shouldn't be a Schedule 1 drug. But that's what I mean by the rocky relationship. It started out as useful and then became criminalized. And what happened was that a lot of people would be swept up into the criminal justice system due to petty drug crimes like cannabis use. So there was a pushback starting in the late 1980s suggesting that there should be something called medical marijuana or medical legalization of marijuana, in which a person, if they had a qualifying condition, they could be granted a card that allows them to purchase or be dispensed cannabis in one form or another. And that was the movement. That pretty much has passed in most parts of the nation, but now the recreational marijuana use remains a political football. It is a controversial issue, and there are people who don't want to legalize it at all. There are people who want to legalize it entirely, and then there are people who want to at least decriminalize it, if not making it legal, so that we are not filling up jail cells on petty drug crimes, right? So there is this pushback going back and forth, and I know Congress is exploring this on a national level as well. So it's interesting, right? So here you have the federal government saying that it's illegal due to DA classifications. You have state governments legalizing it, and there's a conflict. So until that is resolved, you run the risk, if you have a cannabis business, of getting shut down at any moment. So that is the cautionary tale. But the biggest myth that I wanted to bust is that cannabis is not addictive. It certainly is addictive. It has addictive properties, and that's due to the rise in potency of the drug. I hope you found this video useful. You should have been able to identify the various sources of THC, whether it be hashish or marijuana. You should be able to acknowledge various strains of cannabis have different psychological properties. You should have been able to understand how we diagnose a cannabis use disorder and some of the controversies around it. So I hope you liked the video. Hit the like button, subscribe, click the notifications tab, and also send me a comment. If there's anything that you wanted to react to this video, please send me a comment. I read and respond to all of them. Until next time, everybody, take care.